Good evening, everybody, and thank you very much for joining us for tonight's NRAS Live. I'm Ailsa Bosworth, I'm NRAS's National Patient Champion, and I am delighted to be joined tonight by Charlotte Dando. I'm going to ask Charlotte to introduce herself properly in a moment, but she is an expert in foot health and rehabilitation practice for people living with long-term conditions, and our webinar tonight is all about how physical activity impacts foot health. So Charlotte, please introduce yourself.
Thank you so much. So let me get to the slide. So yes, I'm keen to talk to you today about how does physical activity improve foot health. So I'm a podiatrist by background, and I have an interest in ultrasound imaging, and that really started my understanding of well, how does physical activity play a part in looking after someone with inflammatory arthritis. So I started off looking at the joints and understanding where does inflammation sit, and then from there I then started to be like, right, now we know we've got these disease changes, what can we do to help patients manage that disease profile and hopefully live a really meaningful life as part of that.
That's great. Well, thank you for that. So those of you who are familiar with our NRAS Lives, you'll know that after we hear from Charlotte and hear her presentation, I'll have the opportunity to ask the questions that many of you have already pre-submitted, which is great. And if time permits, we'll also have time to, I hope we'll have time to be able to take any questions from the live feed. Over 90% of people with rheumatoid arthritis experience foot health problems at some point in their journey. And sometimes issues can be short-lived and largely resolved by insoles or surgery. But many problems can also last a long time and have a very significant impact on your quality of life. I personally have had more than my fair share of surgery to the feet and ankles. So I'm really looking forward to hearing from Charlotte tonight. So Charlotte, no further ado, over to you. The floor is yours.
Thank you. So as I say, we're here to talk about how does physical activity impact on our foot health. And so, as I mentioned, I'm a podiatrist by background, and it all started because I live with a condition known as hypermobility, so I have really bendy joints, and with that comes with a whole set of symptoms. So fatigue, swelling, sometimes my joints just don't quite work the way that I'd want them to. And what I found during my clinical encounters was lots of people were telling me what I couldn't do rather than what I could do. And this spurred me on to take up a career in podiatry, specifically looking at the ankles, the knees and hips, because they were the things that I always really struggled with. And so I started looking at what do tissues look like under ultrasound. So that's the imaging that we use when we scan for babies. And from there, I then started to explore, well, how do we take what we know and how do we support patients to get better? And this meant I've spent a large proportion of my career looking at rehabilitation, sport, the role of exercise, how consultation should be delivered, and how we should support patients living with arthritis to want to be mobile and active. And so tonight, when we talk about things like rehabilitation, physical activity and exercise, I have in my head what I mean. So I just wanted to share the definitions that I'm going to be referring to with you. So rehabilitation is a set of interventions designed to optimize function and try and improve mobility. So for me, thinking about the lower limb, foot and ankle, I'm thinking about exercise, foot orthosis, footwear, and maybe some of our walking aids that we might use. The World Health Organization defines physical activity as any bodily movement. So that may be walking, taking the grandkids to school, might be doing our washing, cleaning, ironing, is what we're going to be referring to as physical activity. Exercise, however, is a subset of physical activity, and this is when we're thinking about planned, structured, repetitive movements that have a really clear goal. So it might be that they want to strengthen the muscles around the ankles. It might be that you want to be able to lift a certain amount of weight, and it's through that we're hopefully going to see soft tissue changes. So, bit around the background of physical activity and inflammatory arthritis. So 1 in 4 adults do not meet the recommendations of physical activity, and that's those that live with arthritis and those that don't live with it either. And 70% of our rheumatoid arthritis patients will have a loss of strength within their lower limb. And then approximately 60% of people with an inflammatory condition do not achieve the recommended physical activity levels. So there's a real gap between, we know that some of the physical activity stuff is good for us, but how are we going to support ourselves to want to do that? And how can we do that in a safe way? And so when we pull all the literature that exists currently across the world and the UK around the physical benefits of doing exercise for people with arthritis, we know that there is going to be an improved cardiovascular response. So we know that the heart, the lungs, and the blood vessels are going to be more efficient. We know that we're going to increase our muscle mass. We know that we're going to increase our muscle strength as a consequence of that. We're going to hopefully have improved joint mobility, so we're reducing some of that stiffness feeling that we might experience. It also will help us maintain that healthy weight as we start to reduce some of the excess body fat deposits that we sometimes get around our tummies and around our thighs, and then also be part of our stress management strategy as well. From a mental health well-being, we also know that it can help us tolerate our pain a little bit better. It can sometimes improve our thinking and our cognition. It can improve our sleep quality, which, if you're like me, will improve mood elevation overall, and also make us a bit more resilient and tolerant of some of the symptoms we might associate with conditions like depression. So where have these recommendations come from? So the government and the World Health Organization have looked at kind of public policy and have suggested that actually 150 minutes of moderate activity is useful, or 75 minutes of vigorous intensity is helpful, with once a week session of strength building and once a week session of balance as we get older. However, this is okay if you're not living with systemic conditions, but if you're starting to live with conditions like arthritis or asthma, then actually this may not be as easily achievable as we once think. And we think that's probably why we're not able to reach most of this that is suggested to us. So there's something around what should we be doing? And so the narrative is changing now, and we're starting to think actually doing something is better than doing nothing at all. And that yes, this is a great aim to get to, but actually we need to make sure we're doing this safely, that we're feeling confident, and that we're seeing the benefits that physical activity and or exercise can have on us and our foot health. So when we look at our inflammatory arthritis population, we wanted to understand, why are they not doing activity levels? What are the reasons? And so there was 2 really strong themes come out of this body of work, and it really looked at the perception of ourself. So how are we going to actually exercise and introduce movements that look at supporting the foot and ankle if we're in pain, if we've got some stiffness, if there's swelling, fatigue, or joint tenderness? What rules should we be applying? How do we actually go about doing this safely? The second is maybe around our ability as health professionals to show you the value of physical activity, because there's so much information out there that's very generalizable. It's very hard to know, well, which bits should I be taking and moving on and taking forward with me for my health and my well-being. But what we do know is that for people with living with arthritis, that physical activity or exercise that are led by health professionals and include either peers, friends, or colleagues is more effective than doing isolated or home-based interventions. So what this means is that the majority of people are going to do well if they're doing exercise in a group scenario with support. Now, there will always be a small group of people where actually home-based interventions work really, really well. And that might be because you live in a rural community. It might be that you have work and lifestyle commitments, which means you're going to have to juggle and schedule your day a little bit differently. What we do know is that physical activity and or exercise is safe and effective with minimal adverse events. So as long as we're aware of the risks and we've put the right safety precautions in place, we tend to find that actually exercise tends to have more positive effects than it does negative. Physical activity and or exercise can produce benefits without aggravating disease activity. So this is a really important one. If we can get you to be safe and confident and enjoy doing physical activity, it doesn't mean it's going to make your disease activity worse. In hope that actually you want it to be the other way, that it actually makes it easier for you to manage your symptoms and conditions. And I think this really goes to the point that I would like to home in on today, which is no one size fits all approach. You're all beautifully, uniquely individual. And so we need to take that into consideration. You guys are also fully aware of your disease. You know what works for you. And you're also fully aware of you and your interpretation of what's happening to you. You're going to be the most in tune with you. So what we need to do is find ways in which we can help facilitate and support that. And for the foot and ankle specifically, we know that if we are doing physical activity, there are some great benefits that we see. So when we are moving our body, what we tend to find is it has a positive effect on our cardiovascular system. So it can help with making sure that blood is being pumped round the lower limb and that we're starting to either slow down or reverse some of the long-term conditions such as peripheral arterial disease, ischemia. It can also help some of symptoms related to peripheral neuropathy, and it can also help with some of the kind of skin hydration, texture, and colouring. We also know that if we're doing exercise and physical activity that is loading our bones and that we're putting weight through our bones, that we can actually increase some of the bone mineral density. So we can make those bone tissues firmer and thicker, and that can consequently reduce our risk of fractures. So if we were to accidentally slip, trip, or fall, then that's where we can hopefully have some sort of prevention or reducing that risk of developing a fracture. As a podiatrist, the other things I'm going to be thinking about are not just trying to strengthen the bones, but also to use devices such as your walking aids or maybe footwear so that we're able to stabilize you, make you more balanced, and then hopefully having that kind of confidence to be able to walk well. The second or third thing around increasing kind of physical activity is that we do increase muscle mass around the ankle, the calf, and also around the thigh as well. So this means that if we've got more muscle, we're going to be able to pick our limb off and elevate it off the floor a little bit easier. This means that we're unlikely or less likely to scuff the ground. We're going to hopefully have a better posture, so we're not going to be so scrunched over. And so that means that if we're looking straight ahead and forward, we're less likely to miss our placing or kind of feel like we're tipping or becoming unstable. It may also mean that we're able to function a little bit better. So we may be able to get better ground clearance if we're able to use the muscles in our bottom and our thighs and our ankles more efficiently. There's also a link between if we're able to have positive effects with exercise, that we're able to cope with our pain perception and symptoms a little better as well. And I can totally understand from a patient perspective how it's really hard to go, well, how do we go about integrating physical activity or exercise into our daily lives, because actually only 3% of all the research around physical activity has been implemented on a larger scale over the past 30 years. So actually there's not a huge lot of models or guidance out there that can really help support. And that's hopefully where me and some of the team that I'm working with can start to build and contribute to that. We are very fortunate that we are starting to have a different government and a different kind of focus, where we're thinking about healthcare in the community, starting to think about preventative medicine, and also starting to think about implementation. So there's this idea that we can discover stuff, but we now need to move it forward and being like, so how are we going to work with patients? How are we going to work with our service users and our support teams to make sure that people live well with arthritis? And what we can see from when we gather all of the evidence around doing exercise and implementing rehabilitation in terms of using footwear or orthosis or walking aids is that we have some barriers. And these will be different to each person. So this is the first part, I guess, of what I'd like you to do today, is to think about creating a toolkit for yourself. And the first thing to think about is, well, what are your individual barriers? Is it to do with time that you have to be able to maybe implement exercise or to change behavior that you're thinking about doing? Do you have the knowledge, and do you know how to kind of access it and implement it? Starting to think about your beliefs and maybe your attitudes towards certain things. So how do you feel about using insoles? Is it a good thing or a bad thing? How do you feel about using exercise? Is that something that would you be keen to encourage or not? Something about your confidence levels. So how confident are you to deliver? Something around fear, and I'll pick up on that one a little bit later. Our motivation, why are we going to do this in the first place? Finances, our responsibilities as well. It may not be that we just have to look after ourselves, but there may be families, there may be care roles or responsibilities that we have to deliver. Management of our fatigue levels, and again I'll pick that one up later as well, and our pain levels. There may also be something to access to healthcare and support networks. So as you're all joined in tonight, this is a great support network with lots of resources available to you on their website around kind of yoga, sit down kind of classes. There'll be resources talking about arthritis and physical activity. So it's whether you're comfortable accessing that information and having options on where you'd like to go to receive information. And we also know that access varies across the UK in terms of its criteria. If you're in the NHS, there'll be different criteria that you'll need to fit to access different people. So again, it's being mindful and awareness of what that looks like in your area. And then also the one that I found most interesting is weather conditions. So sometimes we find it easier to make changes in the summer months where it's warmer and brighter, and especially if you're someone who likes to do activity outside, then that's going to be more achievable to do in the summer months than maybe in some of our winter months. But what we do know is, how can we get the desired change of maybe implementing some of this rehab stuff? And this is around our knowledge. So it's your knowledge and comfortability with understanding how physical activity and or exercise might help you, and the benefits it will have to your mental health as well as your physical health. The other bit is that, and makes quite a lot of sense, is your confidence on how to deliver and safely execute the exercises and be comfortable with the exercises that you're going to be doing. And for women participants in particular, there's this really strong narrative around having support from family and friends or health professionals to help kind of build the confidence to be able to deliver and implement that. With male participants, this was less of a concern, but in theory, it's making sure you've got your support network around you that can help you if you're going to make changes. And the thing to be mindful of, I think, within the arthritis population is that 66 to 70% of you will have maybe a fear of movement. And if we don't address this fear of movement, then actually doing something like exercise or changing footwear or using a walking aid is going to be impossible to do. And this may be where actually working with a health professional can be really helpful, because what we'll need to do is understand and explore the negative thoughts around fear of moving, and also start to understand how that fear has been developed, and have some strategies in how we might be able to prove or demonstrate that that may not always be the case. And there are, with anything, as we mentioned before, although exercise has a place, it may not be suitable for everyone. So there's something called absolute contraindications. So this tends to be your emergency stuff. So things like having angina attacks or heart attacks, being in kind of heart failure, having infections, maybe blood clots, maybe injury or trauma, is probably not the time to think about doing exercise. I think I'd like you to focus on trying to work out why you're feeling very, very poorly, and make sure that you're accessing the right care timely. However, more logically, there's going to be some relative contraindications, and this may be where we're living with other long-term conditions where we need to make sure that they're fairly well controlled. So this may be things like diabetes, some of our cancers, maybe our breathing, our respiratory, thinking about COPD and asthma. Some of our medicines that we can take can also kind of make us feel a bit unwell if we start to exert ourselves. So again, this is where we need to just be mindful of, okay, I'm working with other health conditions. What are my risks? Who do I need to seek advice and support from? And this is what will happen if you seek a health professional, is actually, let's ask our rheumatologist. I'm thinking about doing some activity, or our GP or our cardiologist or oncologist. Is this something that will be okay for me, or what do I need to be mindful of if I am going to start thinking about adding some movement into my world? And for myself, it's also getting you to think about you monitoring your own self while you're doing movements and activity as well. So checking in with you to check that you're okay, and not that you're not pushing yourself too much, or that you're not kind of aggravating yourself, because you know you the best. And so typically what happens is, if we're going to introduce something like physical activity or exercise into our world, what we're going to find is that our heart rate is going to increase. We're going to find breathing increases a little bit more, and that our body temperature starts to increase as well. And this is perfectly normal. This is normal physiology. We're asking our bodies to work a little bit harder. And we need this to happen so that we can get the tissues to change, so that we can build the muscle strength, so that we can start to strengthen our bones, and so that we can start to see positive changes that are going on. Now, commonly, what I tend to find in our lovely rheumatoid and arthritis population is, when we use our muscles, we sometimes get some feedback. And a common thing that we might find while we're doing the exercise is something called acute muscle soreness. So this is, while we're doing the movement, we may get a sensation that feels like it's burning, and that burning intensifies as we're doing that movement. However, once we stop, it tends to ease and disappear. Now, this is absolutely normal. This is our muscles telling us, oh, you're working a little bit hard here. Can I let you know that we're feeling a bit tired? The other is something called DOMS. So it stands for delayed onset muscle soreness. And this typically sticks around for a day to 3 days. And this is where it can sometimes be really hard to work out what is your arthritis symptoms and what is actually delayed onset muscle soreness, because it can present with kind of muscles feeling tender, might find that joints feel a bit stiff. There may be a bit of swelling around the ankles and the toes if you've been using them. You may feel that you're feeling quite fatigued and tired afterwards. However, we need some of this to happen in order for us to see positive change. So what we also need to worry about or concentrate on is thinking about, how can we manage this when we're doing physical activity? And so ways in which we can manage this are to think about our goal. So if we're going to introduce physical activity into our world, what are we hoping to do? Are we hoping to improve our ankle strength? Are we hoping to be able to do more than 2 calf raises? Are we thinking about being able to carry the shopping in from the car a little bit easier? So we need to have a nice clear goal that's going to help us. The second thing we've got to work out is our environment. So where are we going to be doing this activity? Are we doing it at home? And if we're doing it at home, have we got someone there in case we don't feel very well? Have we got a group of people that can help motivate us and we can share our experiences? Have I got someone that can help guide me through what I should be feeling so that I can work out what is normal for me? And this is where that's a very unique thing about finding out how exercise works for you. The second or third thing to think about is pacing. So a lot of the advice and evidence suggests that you should be doing something every day or every other day. And actually, what our research is showing is that for our patients with inflammatory conditions, actually it's probably going to be a bit slower. You're going to need a bit more recovery. So it may be that you do some exercise on a Monday. You're going to have a few days where you're just going to enjoy the recovery process before you go about doing a little bit more exercise again. And we call that pacing. And so we're finding that we're probably going to have to do movement little and often. The other part is time. So we often find when we're introducing new activities that we get really excited and carried away and want to do a whole hour or a whole 45 minutes. And then we end up the other way where we've made ourselves really sore and really tender. What we should be maybe thinking about is starting off maybe doing, what happens if I do 5 minutes of activity? How am I feeling? Checking in with myself. Am I feeling a bit sore? Am I feeling a bit tired? How are my joints doing? How are the feet? Do they feel a bit achy? Do I feel a bit wobbly? Do I need to maybe do some of the exercises sitting down to begin with and then build to standing up? Yeah. The other thing to think about is then with the terms of time is that we don't have any set goals. So it is really up to you on what you can manage. So for myself, living with my hypermobility, 20 to 25 minutes is probably enough exercise for me to get the benefits that I need. And for me to do that well, I need to do that 2 to 3 times a week, depending on how busy I am and how my tissues are feeling. So again, we need to work out for each individual what is going to be your kind of magic recipe to helping you move a little bit more, but being consistent at the same time. Because we know that when we get it right, people tend to find that there's some enjoyment in moving a little bit more. They're feeling accomplished because they're problem solving for themselves and they're starting to build their confidence with their bodies and their joints. We know that if we get you to build, so if you take on board kind of goal setting, we do finding the right environment, if we get the pacing and the timing right, then actually everyone tends to improve from their baseline, which is their starting point, wherever that may be, whether that's sitting in a chair to standing to moving to running. We also know that there's a lovely social side where people become way more knowledgeable about themselves and their condition, and you start to know your own tolerances and what you can and can't get away with. And specifically in children, it also means that there's a sense of belonging. They tend to grow in confidence as they're able to socially interact with their peers. And they also have this lovely self-awareness that they feel that they're equal to their peers who do not live with an inflammatory condition. And so what we're finding from our data with people who are living with arthritis is that actually, if you can get your pacing right and your timing and you're consistent with that, you will do just as well as someone who doesn't live with an inflammatory condition. The only thing that tends to be different is in our clinic, we do something called a rehab plan. So we take people on a journey over 12 weeks with 5 appointments where we start to build strength maybe in their ankles or their toes or their knees or their hips. And what we find is within our inflammatory population, instead of 5 appointments, we tend to find that you're more towards the 6 or 7 appointments and you're more hitting around 16 to 20 weeks. So you're a little bit slower, but actually you're reducing your symptoms, you're getting strong, you're using the kind of walking aids, the foot orthosis, you're accommodating and coping very, very well. So I guess the key message there is that you are able to absolutely make changes, and that rehab can be a really nice component into part of your toolkit to your medicine management, to help you live well and to keep mobile and active. And so that's that all from me. So I think we're going back to questions. I've left the references there so you can see the kind of data that I have gathered for you and kind of summarised today.
Thank you very much. That was really interesting, and there were lots of moments where I really resonated with that, because I've struggled for a long time with exercise, and this year I've made a real resolution, if you like, that I was going to try and walk more because my right ankle is less painful. So I bludgeoned a local friend who doesn't have RA but have some other health issues into walking with me once a week whenever we can. And I've surprised myself at actually being able to walk much further than I thought I was going to be able to. And it just made me feel so much better. And I've also been working on strengthening and core muscles and resistance exercises. Sometimes not doing perhaps as many per week as I know I ought to do, but I'm not beating myself up when I don't quite hit my goal, but it has made a positive difference, and it has spurred me on to carry on. So I really resonated with some of the points that you made in there. And another thing, just to say that when we did our Stress Matters report, I think it was something like 30% of the people said that they used exercise as a means of relieving stress. So that was something else that I picked up on in your talk. Okay, great. We're going to go on to the questions now, and we've got quite a lot to get through. So let's see how we get on. So first question from Fiona L. OT recommends Sarah exercises and joint protection for hands. Why is there not any equivalent exercise or OT for the feet? RA seems to do similar things to both.
I absolutely agree, and it is something that is on my radar. So it is something that I am working towards. It is known within our research group at the university, and so I have a master's and two master students on it already. So we do want to create something very similar. I guess the adjunct that we also want to correct is something that can support you in the interim while you may be waiting for referrals and bits to come through. But we also want to change the pathway. So we're really keen to look at how care is delivered to you in the health system, so that we can make that process a bit more joined up and feel a bit more streamlined, so that we haven't got these long delays, because actually it's horrible being in pain, isn't it, for long periods of time and feeling a bit hopeless. So we want to make sure that we can see you quickly, timely, and that it meets your needs. So it's on my radar, so I'm doing it.
Excellent. And actually, when you said, several appointments, like 5 or 6 or 7, this is really with a rehab focus, isn't it? Because I think most of our audience tonight will have been going, what? How on earth do you get that number of appointments with a physio, even if you have got a specialist physio in your rheumatology team? Because, we know that there are workforce issues, and not everybody has access to a specialist rheumatology physio. So how does one go about accessing more of a rehab approach rather than a one-off physio appointment? And that's a question from me, because I know everybody will be thinking that.
Yeah, that's really sensible. So this is what I noted. And so that's where the 5 to 6 appointments have come from. I wanted to work out what is the optimal number, because 1 doesn't seem enough. 2 doesn't seem like we're getting anywhere. 10 seems a bit like we might be going on forever. So 5 to 7 was the number that came out when we did the kind of testing. And so now we need to translate that into showing what happens in the NHS. So my next body of work is to work out how we can demonstrate to the NHS that actually having a block of appointments is going to be far more beneficial than having the odd 1 or 2. In terms of what you can do to help yourself, I think there is, for some of you, that actually finding private sectors that will provide packages of rehab may be useful. The other things that can be helpful are online resources. So there's lots of modules. So sometimes being able to educate, being able to kind of understand and have a go can be really useful to then, when you are seeing that individual for maybe 1 or 2 appointments, you can be a bit more confident in directing them, of going, right, I've tried these exercises. How do I change them? Or what do I need to think of next? Or could I have a plan of this and that? So there is a little bit around, I guess I'm pushing the onus on you at the moment, but I'm fully aware that I would love it to be a collaborative of both coming together. The problem that we've had is that the literature is always focused on this kind of one-stop shop of seeing for 1 appointment is going to be enough. But what we're starting to learn with our long-term conditions is that actually they're not going to be curable. It's about managing them over your life course. And so that then now means that the narrative needs to change to go, actually, we need appointments over a period of time. So I'm hoping changing in narrative, building in the research, having you guys keep shouting that you want appointments and you want to work in that way will really kind of start to nudge the health system to design pathways that suit that role for you.
That sounds really great, and we're absolutely behind you there. So keep us posted on your work, because I'm hoping, in fact, that I'll be able to do a BSR podcast with Will Gregory, who's a physio at Salford, who's done stuff with us related to exercise. So yeah, absolutely with you on that. So next question. Since changing RA medication, I've been very prone to fungal infections in my feet. Any advice on preventing reinfection?
Absolutely. So I think the first thing when you see it, start putting on the topical creams, because the longer it sits on the skin, the harder and longer it takes to get rid of. Once it's all settled, then I would start to change socks regularly and wash at slightly higher temperature to kind of 40 to 60 degrees. That will hopefully reduce the fungal load that might be sitting in the material. You may also find using antifungal sprays in shoes can be really, really helpful. And then there is also just thinking about where you might have kind of come in contact. So having your medicines may make you immunocompromised. So again, it's just that general visual checks each day. The other thing is thinking about if you've got toes that are kind of overlapping or very close together, you can sometimes get moisture that sits on the skin. And sometimes that moisture can then break the skin down. And we naturally have bacteria and fungal spores that live on our skin, and they're very opportunistic. So if they find a nice, warm, wet space, they're going to make themselves at home. So what you can do is, if you notice maceration on the skin, is use a little bit of surgical spirit once or twice a week, just to kind of keep everything nice and dry and clean.
Okay, that's great. Thank you. So next question from Laura Rothery. How can I address severe soreness in the feet after 2 cycles of rituximab, which feels similar to PF? And I'm not quite sure what PF is, but you might know that. But without it being dismissed as just RA. Yeah,
so PF, I think he's referring to a musculoskeletal condition called plantar fasciitis. It's on the bottom of the heel would be my guess. Right. It's hard, isn't it, when the skin is really sore? I guess the first thing I'd be thinking about is, are we got any bruising? Do we have any marking? Is there any kind of breakdown? If the skin's broken down, then we need to kind of make sure that we're keeping it clean and protecting, and also start to contact your rheumatology clinic so that we can work out why is a breakdown happening. There may be something going on at the skin level that we need to address. In terms of the soreness, it's thinking about what brings on the soreness. So is there a particular type of shoe that might aggravate it? Is it that you're walking barefoot? If that's the case, we may find a shoe that has a kind of insole that's very cushiony, can be quite comfortable, that can just take some of that pressure and load off. And for some people, if we know it's tenderness and soreness in really specific areas, we might be able to create an insole that offloads and deflects some of the pressure. So we do that through padding and using really soft materials to just kind of help make sure we redistribute some of your load or some of your body weight a little bit better in the feet and ankles.
Okay, thank you. Next question. Any tips? My toes stick together and cause upper foot pain, muscle, tendon, and calf pain.
Yeah. So in terms of the toes sitting together, you may find the use of things like silicone devices, or they're called silicone sleeves that go on the toes. They can just help kind of separate them, which can make things more comfortable. In terms of the thinking about the muscles and the cramping, it depends on what the foot is doing. So it sounds very mechanical in nature. So it sounds like there may be some muscular kind of aspect at play. So that may be where actually having a review might be really helpful, because if it is things like deconditioning, so muscles might be weakening around the foot and ankle, there are some really nice specific targeted exercises that can be given that can actually strengthen those and then reduce the cramping onset for you.
Okay, that's great. Incidentally, if anybody does want to ask a question, I don't know whether we'll get time to deal with any more at the end, but please do put your question into the comments. So a question from Anne Stillman, who has juvenile idiopathic arthritis. She has fusions on the midfoot, big toe, MTPJ fusion, excision of 8 MTP joints, and hard to keep active with foot pain, stroke nerve pain. I wear orthoses and shoes.
Yeah,
I guess she means there.
Yeah, there's a lot going on there. I can absolutely see where the foot pain is coming from. So again, the orthotics and the shoes are great. She's got the first part kind of there. I think that the bit that I'd be keen to look at is how is the strength. So if you've had lots of surgery, we do get a natural kind of weakening of the tissues because you are immobilized for a period. And that lovely saying, if you don't use it, you lose it, is kind of half the truths. So there may be support needed to just kind of strengthen the muscles in the legs and the ankles. Now, she mentioned that standing can be really uncomfortable. So that's where kind of chair exercises can be really good. Using resistant bands and tone loops can be a really nice way. So the resistances are kind of really easy to really tough. And within our clinic, we've been able to demonstrate that we can get just as much muscle change as lifting weight with some of the lovely resistance bands. So I'd probably be really keen to just double check what muscle structures are strong and weak or not quite working, and then really think about giving you a set of exercises that can be done sitting down while watching TV, while kind of doing other fun bits to try and get you to kind of build up strength around those foot and ankle structures.
Yeah, that sounds really great. I mean, I've had long periods of immobility when I've been recovering from foot and ankle surgery, and you lose that muscle so quickly. And so I've got a bag of bands and weights down by the side of the chair. So it's very easy when you're watching telly just to do something. As you said earlier, doing something is better than doing nothing at all. So good advice there. So next question, hammer toes, weak ankles, any advice?
Yeah, so hammer toes, you have a couple of options. You can go down the accommodative route. So that involves little devices that we can make to kind of help reduce pressure if you're getting kind of callus build-up, or separating them so things feel kind of more comfortable. In terms of what was the other one? Sorry. So hammer toes.
Weak ankles.
Yep. So you've got hammer toes. You can either do the accommodative side or the surgery side. So that is a lot of kind of opening up, straightening, pinning, pulling back together again. It can be helpful and beneficial for some patients, but there are risks associated with surgery. So definitely working with our podiatric teams and our orthopedic teams to check that that's suitable, as well as your rheumatology, because it will also be on your health, and your ability to heal will also be really important. The other side around weak ankles, there are lots we can do. So, and there's lots around exercises to strengthen the muscles around the ankle. I'd also want to focus on your toe strength, as well as your calf strength, as well as your balance and your proprioception as well. So you may find that if you're walking on uneven ground, it can be a bit painful, or you find you become unstable. So we'll want to tap into the nervous system as well as the muscle strength system as well. And a physio or podiatrist with rehab experience will absolutely be able to guide you through that.
Great. this person is saying, I'm struggling to get much routine with my daily steps due to inflammation. Do you have any tips, tricks, or targets you could recommend to help me stick to it?
That's a really good question. So I think the 10,000, if I remember correctly, the 10,000 steps came from a marketing advert in Japan. And then it was really well adopted. The aim was to just get people to move a little bit more than what they were. And so this target number has been a thing that everyone aims for. Actually, it's a really large number. And so what I'd really be keen to do is to shift your focus on maybe thinking about what does success look like for you? Is it that you're doing a couple of smaller walks a couple of times a week? Is it like enjoying kind of social interaction while doing exercise? Is it that you're doing just a few exercises that take kind of 10 minutes out of your day? So I think don't worry about the large number. Little and often, putting in the pacing, finding the time that works for you and what you can tolerate, I think will be the key things to making you feel like you're being successful. And don't beat yourself up if you find that you can't make that number. You are doing, I always say to my rheumatological patients, you are incredible because you're not just living with daily life, you're also living with a condition that also is trying to make life very difficult for you as well. So you're also problem solving, adapting and changing, and that is absolutely okay. So have a nice goal, but don't beat yourself up if you don't quite get there every day. It's the small amount that will get you there in the end.
Yeah, absolutely. I just think that whole 10,000 steps a day thing is so demotivating when you know that actually if you did even 1,000 steps, that would be amazing. And, you know, you go into the office and people are saying, oh, I did 25,000 steps this weekend. And you just think, oh, God, there's no way to do that. So I think I'm just so glad to hear you say that. Whatever you can do is the right amount for you.
Absolutely.
So somebody called Jim asking, can you recommend any insoles for somebody with RA?
Yeah, oh, this is a tricky one. So insoles are used to help for two things. So it can either be to cushion if you've got very prominent structures on the bottom of the feet that you want to kind of give a bit of a cuddle to and a bit of a support. And if that is something, then something like a duo soft insole can be really helpful. And it's not doing anything in terms of changing the way we walk. It's just mostly accommodating the fact that we may have some bonier parts on our feet that we want to protect a little bit more. In terms of an insole, this is between kind of science and art come together. So insoles are used to try and help deflect kind of either pressure and to kind of facilitate a better movement through those joints and soft tissues. And that is really unique to each person because no one has the same gait or walking style. It's a bit like your fingerprint. It's completely unique to each of us. So that's where something like a podiatry appointment where we can look at the way that you're walking and the way that you're positioning and placing your feet during your kind of walking strides will really help make sure that we're providing you with an insole that fits your prescription really well.
Okay, thank you. So there's two questions sort of linked here from a lady called M. Could you suggest seated exercises to help with the burning and throbbing sensation in my feet, since my RA has made my exercise routine non-existent and she finds it difficult to walk even a short distance due to her RA? Is this normal and what can I do to feel better? Now, to some degree, I think you've answered some of that already. And actually, I would add that there are, if you haven't seen our SMILE modules on exercise, then I'd strongly suggest you try those because there are 5 different types of exercise. It's a 15-minute workout and you can do it sitting down or standing up, and it will help if you can't walk. And I hope that, you know, doing something in that way is going to help you feel better, that you are actually doing something positive to improve your muscle strength and so on. Would you agree?
That's a great starting point. I think be curious, start to think about what works for you and what interests you, because then that becomes the motivation.
Great. So a question from Chris Robinson. How effective is surgery to remove a bunion, stop a toe from crossing over another toe and straightening the bent over toe? These are all problems I have.
Yeah, oh, no, again, another set of poorly feet. So surgery has its place. It can be really beneficial. The struggle that we have is that the data doesn't show us what patients are going to do very well on surgery and where there may be complications. So there is always risk with surgery, and that's where I'd really get you to really talk through with a podiatric surgeon or an orthopedic surgeon about what the options are in terms of the surgical procedures, because different ones will have different levels of commitment post-surgery, but also in terms of how your medicine management is going to be made as well. And so hopefully you can then start to see kind of what the success rate is for those individual procedures, which will help you come to an informed choice.
Thank you. So a lady called Sandra Mead Hoyle is asking, can RA cause small fiber neuropathy of the feet? So you'll need to explain what that is first.
Yes. And small fiber peripheral neuropathy is commonly termed as peripheral neuropathy, and it's this funny feelings that we can get in our hands and feet, sometimes kind of burning, numbness, tingling, stinging sensations are kind of typical. And yes, there is a link. So research has kind of demonstrated that through the arthritis with the inflammatory processes, we think that that as a cellular level is starting to aggravate and change some of the nerve tissue, and then the nerve tissue doesn't work quite as we'd like it to, and so it can either misfire or misinterpret some of the signals that the soft tissues are giving, which give this false sense of kind of stinging, burning, tingling, and that we might experience. We do know there's a small body of literature that's starting to build that if we can move a little bit more, then that can sometimes help the kind of feedback that we get in terms of our nervous system. It can sometimes dampen it down or quieten down those kind of noises. Likewise, there are medicines that can do that as well.
Okay. Eileen Machen is saying, I have RA and I'm missing cartilage in the talon avicular joint in my right foot. Is there an alternative to having an operation? I'm 79, she says.
79 years young. So yes, so the talon navicular joint is within the ankle, and yes, over time that can mean that the joint space becomes narrowed, and yet you can absolutely get pain, and it become really hard to load the joint, and everything just feels very uncomfortable. So surgery is an option, and the other option that you may find helpful is can be use of orthotics, so using insoles inside the shoe just to kind of help kind of reduce some of the impingement that might be happening within the ankle joint. Can be sometimes physical therapy or exercise like we've talked about today. So if we can strengthen the leg, specifically the ankle muscles, the calf and the toes, that can sometimes mean that we're not putting quite so much load through the ankle joint, which can make things a bit more tolerable. And there is also sometimes, depending on if there is active inflammation present, sometimes injection therapy may be considered as well. However, that depends on tissue activity, but is an option that can be part of that toolkit to help.
Okay. Is that part of the subtalar joint?
Yeah, that's it. Yeah.
Okay, because I've had my subtalar joint fused in my left ankle, and that did help with the pain enormously. Just
surgery is the preferred one if it's to reduce pain. Is their goal. So again, thinking about what is the goal and what is the aim, and what are your tolerances? What are you willing to accept?
Right. Got time for one more question, I think. If I stand or walk too much, I suffer for a while with nerve shooting pain in my left foot. What could be causing that? Probably a variety of things.
There are lots and lots of things. That seems like a very mean exam question. So I think my advice would be is to find a podiatrist that can do a full assessment, that can have a look at the foot, have a look at you in context of you and what your kind of routines are, and then hopefully they will be able to give you a diagnosis and B, the options for kind of treatment and management moving forward.
Great. I think that, you know, anybody who wants to embark on an exercise program or increasing their mobility, getting an appointment with a physio in your part of your team, if you've got one, or a community physio, your GP, if you haven't got a specialist rheumatology physio, is a great starting point, so that you can get the right advice for you individually. Well, that's been absolutely brilliant. Thank you so much, Charlotte. I hope you'll come again at some point in the future, because I think really, really informative presentation and some great answers to the questions that we've had put. So if I can just remind everybody, SMILE, our e-learning program, has an exercise module, which is actually quite long. But we've now split that into 2 modules to make them shorter. One on science behind why exercise is beneficial in RA, and one is going to be called Let's Move, and it's about the practical application of movement. And we'll be launching those 2 new modules soon. But the existing 15-minute taster sessions, which we have on Tai Chi, yoga, movement to music, tripudio, which is sort of lymphatic flow movement, and strengthening and resistance exercises, those are all available to be done seated or standing. And you can use them as often as you like or as little as you like. The choice is yours. But do go and investigate that. If you haven't tried our SMILE exercise program, then please do. It's easy to register. You just go to our website /SMILE, and the registration process is very quick and easy. And please do investigate. So just a few more messages before we say goodnight. Our Chief Exec Peter will be our guest speaker at our Worcestershire group local meeting on the 29th of July. So if that's in your locality, it would be lovely to see some of you there. Our Working with Inflammatory Arthritis Join Together group, which is one of our online regular group meetings. The next one's on the 18th of August. So don't forget to register by visiting our events page on our website. It's always a popular one. We also do have a Join Together group on exercise, and you'll find out more information on that on the website as well. August does tend to be a bit quieter for our group meetings across the country, so do go and check out when your next local meetings are, if you don't know. And it's not yet on the website, but on the 15th of September, our Swansea group is having an online meeting, and they've got Jessie Eloise, who is going to be speaking and doing some chair yoga. So do check all of those out via the website. And our local and online events do run throughout the year, so it's really useful to visit the events page on the website just to get more information. In September, we will be having our 2025 RA Awareness Week, and that will run from the 15th to the 22nd. Is going to be about symptom checking, but there will be lots of other things going on during the week, so do keep an eye out for information on the website. And our next NRAS live event will be on the 1st of October, and the topic is going to be diet and nutrition. So it just now remains, with 2 minutes to go, how about that for timing? It just remains for me to thank you all very much indeed for joining us tonight. And thank you, Jeff, who is our technical behind the scenes digital manager tonight. Thank you for your support. And very shortly, this webinar will be available to watch back on our YouTube channels, and we will be promoting it over the next week or two. So thank you very much. Have a good rest of the evening, and good night, everybody. And thank you, Charlotte.
Thank you for having me. Thank you.